Okay, Peyton, we good? That should be off soon. Okay. Okay, guys, welcome to the low back pain workshop. Mike, I know you already know a lot of this stuff, but um, I really feel like part of my responsibility in this is to educate people on the reasons that back pain happen in the first place. Because I feel like a lot of the proposed fixes of it, they just either they're really short term, or we have a really hard time keeping it conservative, meaning people want to move into pretty invasive approaches to fixing back pain. The opioid epidemic and pain management with injections and all that, and then somebody wants to cut on you and your life's never the same. So there are one of the first things that I want to communicate is that there are like a multitude of reasons as to why somebody's back could hurt them. So I have a pretty considerable problem with anybody who can say that this is the reason and this is the fix that is going to fix everybody's back pain, because one person's pain can be so considerably different in origin than somebody else's. Also, to communicate what this is about, which is maybe even kind of a little bit about what we've talked about, where you're at, is there is a pretty significant difference between how I would choose to take care of somebody who's in acute low back pain, like they have a disc herniation or a compression fracture, or like something that there's an acuity that if anybody's ever been there and done that, it like debilitates you for a season where you can hardly move. You see people that are kind of that side bend tilt. They have radiating numbness and tingling things down their legs. Like, I would choose to talk about different things if that were the case, and how I would take care of that, than what I'm going to talk about today. This is more along the lines of, I've had this ache and thing that for a while when I do these things, and it intermittently bothers me. I feel like I have no control over it. I feel like I'm waking up stiff, and it's almost like this cyclical pattern of back pain that I can't get rid of. Those are oftentimes two totally different approaches to what I would advise people to do for them. So we're going to be talking about this one today. And again, I'll reiterate that not all back pain is created equal in its origin and its reason as to why it's occurring. So I'm going to talk about common things that I see. I'm not outlining today something that is going to fix everybody's back pain. We're far too complicated of machines to say that. So I'm gonna teach you guys some things that I'm seeing commonly that I'm addressing regularly, that is providing people with relief with some instruction. This really is something I'm actually fairly passionate about in terms of teaching people why they may be having back pain. Most of the time, I would say 99.9% of medicine is going to say that an individual has back pain because of some tissue, whether it be an arthritic facet joint, or a disc, or a muscle spasm, or something, that tissue under stress is why that person has pain. This is like, you need to go get an MRI for that, and then the image says this, and this must be why you're having pain. And the reality is that is not always the case, and it's really only part of the issue. Sometimes a person's anatomy can change pretty considerably in an instant, and that very well can be the reason why somebody's in pain. But in most cases, I have found that it has nothing to do with that, actually. It's only a small piece of the puzzle. A lot of people will give you different types of things to do when you're having back pain. This solves a little bit more of the problem in terms of the why, saying maybe somebody just doesn't move very well and that's why they're having pain. Or maybe somebody lacks stability. So you hear the word core used a lot in treating low back pain. Or you hear people, you need to stretch your hamstrings or those types of things. So we're starting to get to a little bit more of the underlying issues on why this might be occurring. Like, hey, maybe an individual doesn't move very well, or hey, maybe an individual can't maintain spinal stability through movement like they need to. And again, that's getting somewhere, but this is really what I'm seeing is the main issue. It's certain patterns of movement that we have, whether they're postural positions that we are in for a prolonged period of time regularly, or things that we are asking our body to do regularly and repetitively that create imbalances in structure and function, maybe asymmetry from one side to the other. A lot of people, it's like, I really only have it on this side, or I'm really only locked up here and not there. And the majority of the time, it creates a poor position of the skeletal structure, namely the joints. And those joints being in a poor position over a long period of time, driven by these bad movement patterns, are actually why people are continuing to have pain. We'll get to a little bit more of the explanation of that, but I really want people to understand that I think the real reason why people have low back pain is their brain has patterned the body into a position that is a bad position for what they're asking it to do regularly. And it can't move normally through its normal biomechanics in order to be able to achieve what you're normally asking it to do. And because of that, then tissues become under stress. Then we lack mobility somewhere. Then we lack the ability to have spinal stability somewhere. So in my opinion, it's not really the chicken or the egg here. This is the issue. It's that people are they actually are stuck in these patterns of movement and these postural positions, and they cannot get out of them in order to be able to achieve normal human movement. That is what causes the tissues being under too much stress over a long period of time. Honestly, the more that I get involved in it, it all is. It all is. It all has to do with our ability to influence this. This controls all the muscular structure, which puts the skeleton in a certain position. So the majority of what we're trying to do is actually to retrain this to teach our body how to be in good position, how to inhibit certain muscular structures, how to activate certain ones when we need to, and how to move freely. That really is honestly the key. So a lot of what we're going to be going over here when we talk about how to fix this is we're trying to rewire and restructure the circuitry that tells our body where to be in space. Okay? So that being said, common patterns that I'm seeing, especially as it relates to low back pain, are the body being forward on a plumb line. So I have some examples of that. We're going to get to that in a minute that you can see in these diagrams. Meaning, if I dropped a line down somebody's side, their body would want to be relatively forward as it relates to that line. What that does, what that creates in a lot of ways that you can see in this diagram here actually, is that it creates compression on the skeleton and the muscular structure on the back side of the body. So in a lot of ways, this is why when the body moves forward on a line like this, it actually creates compression on the structures behind you. That's why people lose disc height over time. That's why the facet joints create arthritis there. That's why you see spinal levels sometimes move forward relatively on the tailbone. So it's because the body is stuck in a relative forward position. This creates an extension or compression moment of the lower back, this area right here. If I could just draw a box around that in this diagram here, that right there, most of those tissues are under compressive and extensive stresses right there. And that's why that sort of accordion type of a problem and not being able to get out of that over time is why people are having low back pain. Right here. That being forward and compressed, okay? It manifests in the body's pretty dramatic inability to be able to rotate everywhere. So if you notice that my hips are also stiff, or I lack the ability to kind of roll over or to be able to kind of twist my body in a certain way, you will notice that as the body goes more forward without the ability to retreat and also go backwards, and as compression happens on the back side of the body, it will not rotate very well. And that's a problem because we have to be able to do that in daily life. To be able to achieve the majority of things that we're doing when we move, we have to be able to rotate, okay? So these are common things that I am seeing, okay? So here's a couple of examples on a plumb line, right? If I'm drawing a normal, happy person, they're relatively pretty balanced from a forward to backwards position. And this is only one of multiple plumb lines. It's not like we only move in one plane at a time, but I'm just trying to communicate that this one in particular is a pretty dramatic issue. Sometimes somebody can have what's called an anterior pelvic tilt, where the pelvis kind of tips its way anterior, and you start to see the lordotic curvature of the lower part of the spine, specifically the last couple lumbar levels and the tailbone and the sacrum. They really want to tip themselves forward. And that anterior pelvic tilt puts the whole box and pelvic structure forward on that plumb line. Sometimes you'll see what's called like a sway back posture, where it's not necessarily the rotation that does that. It's just that the glutes in the lower back have pushed the back forward and they're sitting back like this most of the time. So it's almost like the entirety of the lower back and the pelvis is just forward on the plumb line. And to make up for it, so we don't fall over, people lean backwards. These are not exclusive, but these are very common forms of what it is that I'm discussing here. Us being too far forward, creating compressive stresses on the low back that they cannot alleviate from, okay? So what we're going to talk about here now is these are common things that I'm seeing as to why people might be having back pain. What we're going to talk about here is actually how we're supposed to work. So this is what I'm seeing really commonly here. It's like, this is why I think people are having problems. This is how we're actually supposed to move, okay? So I teach everybody an analogy about a slinky. Did I teach you this? The slinky? Yeah. Okay. So most people have played with a slinky or whatever. They understand the concept of a slinky. If not, I kind of drew one up here. The human body is basically a series of connected helical structures that are filled with air and fluid. And whenever we move anywhere, we have to have the ability to simultaneously create a compression moment somewhere and an expansion moment elsewhere. I'll use my elbow as an example. If I flex my elbow, I have to be able to create compression on the front side of that joint and expansion on the back side of that joint in order to be able to achieve movement. If my elbow is full of too much fluid, say I hit it on something and it's big and I'm trying to flex it and it doesn't bend, It's actually because I usually lack the ability to either compress on one side, expand on the other, or both. So, as it relates to the lower back, okay, because the lower back is almost always in a compressive state, it has a really hard time being able to expand. So a lot of what I like to teach in terms of what fixes this problem is creating expansion strategies on the back side of the body. So this gives us actually, once we gain the ability to compress somewhere and expand somewhere, we have to be able to do what's called reciprocate. So similarly with my elbow, okay, if I'm creating a compression strategy here and an expansion strategy here to flex my elbow, when I extend my elbow, I have to do the opposite. So that's the ability to be able to reciprocate. So some people hurt their backs, and a lot, in my opinion, a lot of disc herniations happen because there's such a compression moment on the back side of the body that when they go to expand it, they lack the ability to do so. They lack the ability to reciprocate, and in turn, that the anatomy changes. It breaks because it can't tolerate it. Alternating is our ability to do it from one side of the body to the other. So if it was just a fixed joint that we were talking about, like an elbow, we wouldn't really need to worry about that. But specifically, most definitely, as this area here, you got to be able to do it on one side of the body opposite to the other. So these are like some of the things that we've been working on with, like opening the back side of the hip up and doing it one at a time. So you have to be able to move from one moment of compression and expansion to the other. That's being able to reciprocate. And then being able to alternate is saying, I'm going to be able to do that from one side of the body to the other. That also enhances our ability to be able to rotate. These things are what gives our body the ability to rotate, which is really the key as it relates to mobility. So, are we good? Any questions? That's a great question. Flexibility is a component of mobility. Flexibility is usually as it relates to just the muscular structure. So say for example, we'll just take the bicep because we're on the elbow, right? If my bicep muscle, if it holds too much tension or it lacks the ability to lengthen appropriately, I will not be able to completely extend my elbow. Okay? So sometimes addressing the flexibility of the bicep can help me extend my elbow. But mobility can also just include the joint structure. Maybe there's something within the joint that does not allow me to be able to, say I don't have a particular type of glide or rotation in the joint structure that allows me to be able to achieve that movement. Mobility is a little bit more of a comprehensive thing than flexibility. Flexibility is just one proponent of mobility. It's important. Most of the time, well, if we come back here when we were talking about real problems and like solutions that people have, the reason that most of the time just static stretching does not work is because we're not changing the position that somebody's in. So 30, 60 minutes later, 3 hours later after you get done stretching, it just comes right back. It's like that pain, that stress, that tension you were having, it comes right back because you never changed what that muscle needed to be capable of in the first place. So I have just found so much more success in taking care of chronic forms of back pain of a bunch of different kinds of variety, treating it by influencing patterns of movement that create poor position as opposed to just addressing mobility. That's a part of it, but if I can't change the position that somebody's in and the pattern with which their body moves and behaves, most of the time it's just going to come right back. Strength is even also a proponent. If I strengthen the structure in a poor position, I'm not doing it any good. It is. You have to, you have to teach the body how it's supposed to move. Have you ever seen a toddler move before? I have them right now, so I watch them all the time. And their ability to be able to get in certain positions and do things is uncanny. Like you watch them and you're like, man, I wish I could do that. Well, the reality is that relatively our body actually should be able to achieve the majority of the things that they do. It's our lack of ability to get into those particular positions that starts to create skeletal breakdown. Like our joints are under too much stress because they're not able to move the way that they're supposed to. So the fix it is to actually teach our body how it's supposed to move. Coming back to the common patterns that I'm seeing influenced appropriately, it's trying to get the body to move relatively backwards on a plumb line, and usually restore the ability to rotate in that position. So the first thing that we're going to do today as it relates to fixing it is I'm going to teach you guys, and this might be all we get through, but I'm going to teach you guys some positions that you can get in with both passive and active movement that can help your body learn how to inhibit muscles that are way too tight all the time, activate muscles that don't work very hard, restore quality position, joint position, and help restore our ability to be able to do these things right here. Just by getting in these positions. Usually, this part of it, if we get to this right here, choosing different kinds of movement patterns, this is where it gets advanced, where you can use training principles like, things that you do in the gym or things that you're doing exercise-wise that can actually enhance your body's ability to be able to do this, to be in good position and move the way it's supposed to. A lot of people are exercising and doing forms of recreational movement that in reality they should not be doing because they're actually robbing them of the ability to move well. When you get done exercising, it should actually help pattern your body in an ability to where it moves better than it did prior to training. That should be the point. So for example, if somebody's got knee pain and they have knee pain when they're doing a squat, okay, and you keep doing this particular type of a squat with this kind of loading principle, and it keeps producing knee pain, you're not moving better than you did prior to that. So a lot of times people will just avoid doing that movement. But in reality, there are different ways you can achieve that actually help you be able to become better at a squat. The same would hold true for low back pain. People will avoid things like they'll avoid, bending over, or, they'll avoid getting on the floor or things because it's just like it hurts to do so. But what we're going to be talking about here in a minute, what we're going to be demonstrating and going through, can actually help your body achieve good movement so that it can do those things without having pain. So this is like a cautionary tale. Like I could do a whole other seminar on just this piece here, choosing different kinds of patterns of movement that either limit and inhibit or enhance a person's ability to move. Why a squatting pattern could negatively influence a person's ability to move their hips, or why an overhead pressing movement can actually negatively or positively influence a person's shoulder and position. Like there are a bunch of I could talk another hour on just that. But what I really want to talk about today is how can we put the body in good position to be able to alleviate some of these movement patterns and imbalances and asymmetries that create compressive stresses on the anatomy in the low back. So we'll talk about some specifically, at just this region here, that gets the spine to decompress and flex a little. And then we'll also talk about some stuff that opens up the backside of the hips, which are some of the strongest muscles, most powerful muscles in the body. So influencing them positively usually yields high results in terms of being able to move better. And they're not all created equal. Like being able to influence the top half of the backside of the hip is different than influencing the bottom half. We'll maybe talk about that a little bit too. But some of this, yeah, see, most of the time, as it relates to low back pain, most of the time it's that people's glutes are firing all the time when they don't need to. It's almost like the glutes have squeezed to propel the body forward all the time. And so they lack the ability to move into that space. So they lose the ability to flex a hip or rotate a hip because those structures they just don't know how to calm down. Not being able to fire appropriately can be talked about as is related to dynamic movement, like, lunging or stepping up a stair or whatever, not being able to make that mind-muscle connection. And that, in a lot of ways, can attribute to different forms of pain. But specifically with what we're talking about today, it's been my experience that people really have a hard time shutting those things off. This is why when everybody gets past like the age of 45, they lose their rear end. Now people, it's like, especially males, like their rear end just goes away, right? And you look at them from the side, they can't get a belt tight enough to hold it around their rear end, right? Most of the time, it's not because there's an actual lack of strength in that musculature. It's that the body never gives them a chance to really relax. They're under tension all the time. And them being, it's appreciable when you look at this picture that if muscles that big, that strong, that cover that much actual geography of the body, that if they are under tension all the time, that it can wreak havoc on the area of the skeleton that attaches to. So we're going to move into, we'll go through some of these positions. I'm really only going to go through 3 positions, and then those 3 positions I will talk about things that you can do in them. So maybe there might be 3 to 5 different things you can do in that position depending on what your body might need in order to be able to achieve quality movement. Any questions before we move on to that? Okay, you can cut that now.